Hello, my name is Mandy Wink, and today I will be showing you how I made my glenohumeral joint model. So here we have the clavicle, the scapula, and the humerus in anterior view. And then over here we have the posterior view of the clavicle, scapula, and the humerus. And this is the right side of the body. For the clavicle, it is made of styrofoam. And as you can see here, it is screwed onto the acromion process of the scapula. For the anterior side of the scapula, it is also made of styrofoam. In the posterior side, the spine, the scapula, and the acromion process are made out of styrofoam as well. Majority of the posterior region of scapula is made out of dough, as well as toilet paper roll over here so that it can mimic the glenoid fossa region over here to allow the head of the humerus to insert. And the head of the humerus is made out of the top portion of a water bottle and a straw with bubble wrap stuffed inside to help stabilize the humerus. Over here, the blue elastic band represents the glenoid labrum. The glenoid labrum deepens the socket of the glenoid process, as well as absorbs shock and improves the congruency of the joint. There are 5 ligaments of the glenohumeral joint. They are the superior glenohumeral ligament, the middle glenohumeral ligament, the inferior glenohumeral ligament, the coracohumeral ligament, and the transverse humeral ligament. The glenohumeral ligaments are intrinsic ligaments. The coracohumeral ligament is an intrinsic ligament. The transverse humeral ligament is an extrinsic ligament. It holds the bicep tendon in place in the bicipital groove, and it does not stabilize the joint. There are also additional features in the glenohumeral joint. There is the subacromial bursa, the subscapular bursa, and then the articular capsule. The ligaments are made out of elastic bands, the bursae are made out of chewy candy, and the articular capsule is drawn at the bottom. The subscapularis is located on the anterior side of the body. It originates in the subscapular fossa and inserts onto the lesser tuberosity of the humerus, located here. Here on the posterior side of the body, we can see 3 muscles that are shown. The first one is the supraspinatus muscle, which originates at the supraspinous fossa and inserts onto the greater tuberosity of the humerus. And we can see this is the infraspinatus muscle, which originates at the infraspinous fossa and inserts also onto the greater tuberosity over here. And lastly, we have the teres minor, which originates on the inferior part of the lateral border of the scapula, and it also inserts onto the greater tuberosity over here.